In 1986, the state of California introduced Proposition 64 on the November 4th ballot. The language of the proposition was written by activists associated with Lyndon LaRouche, who formed the Prevent AIDS Now Initiative Committee, also known as PANIC.
California won't panic, no on 64. California won't panic, no on 64. California won't panic, no on 64.
In 1986, there was an initiative on the ballot, California, to quarantine people who were HIV positive by a right-wing fanatic called Lyndon LaRouche.
64 is not the way, stop LaRouche and save the day. 64 is not the way, stop LaRouche and save the day.
Proposition 64 essentially would include AIDS on a list of diseases which can be regulated by the state based on the fact that they are communicable. And in that manner, it would give county health officers the power to prevent people who have AIDS or who carry the AIDS virus in their systems from working in schools or as food handlers, and would give them the ultimate power to quarantine those people if they felt they posed a health risk to the general public.
No more manzanars, no on 64. No more manzanars, no on 64.
We planned a torchlight march on the headquarters of Lyndon LaRouche, which was in Atwater Village.
No on 64. No on 64. No.
We got people like Patty Duke, who was the head of the Actors Union, and some different political figures to back us.
It scares me, and I am frightened.
At that time, we thought that the odds were that it was going to pass, which was horrifying. But how it turned out was that it lost overwhelmingly.
We assembled here tonight will be the voice of conscience saying to Lyndon LaRouche, go elsewhere. This is not where you will have your victory.
So when the campaign was over, we said, well, we've stopped something bad from happening, but what do people actually need? And literally, people were dying in the hallways of the county hospital. And so we said, you know, the least we can do is give people a dignified death. We were always an advocacy organization. And so one of the things we did at the beginning was we formed this blue ribbon panel, this commission on hospice care. And we held an all-day long thing, and we had people come and testify what the needs were.
How many of you have been to 5P21, the AIDS unit in USC? Because if you had gone there, you would see exactly what the medical treatment is being like. They're overcrowded. They're understaffed. The rate of burnout is incredible. You see patients who are weighing 90 pounds sitting on a wooden bench for 3 to 4 hours. This is not humane to me, to see people suffer. We have a hospice program that is working in San Francisco. We have a hospice program in New York that is working. There's no reason why we can't look at their programs and then start one here in LA. Because I'll tell you, anyone with AIDS would rather die at home than die at USC.
But then we started campaigning about the neglect that LA County was visiting upon the community. And so we wound up having a candlelight march to the home of the then chair of the Board of Supervisors, Mike Antonovich, who had said that the way to deal with AIDS was for gays to turn straight.
Why is this occurring? I think the reason is very simple. It's basically homophobic bigotry, and the government does not care. Health and Human Services, Margaret Heckler says, we have to stop AIDS before it spreads to the heterosexual community. In other words, who cares about gay people?
We got then Supervisor Ed Edelman to put forward a motion to give $400,000 to us for the Chris Brownlee Hospice. Then a conservative Republican on the Board of Supervisors named Pete Shabara, he gets up and he says, well, I don't understand why all this money should go to Edelman's district, you know. So Edelman thought very fast, and he said, I agree with you. I think we should have $400,000 for each of the 5 districts. This is the first time in the history of Los Angeles that people went in asking for $400,000 and walked out with $2 million.
The AIDS Hospice Foundation formed to address a dire need. And in 1988, AHF opened the Chris Brownlee Hospice, a 25-bed care facility near Dodger Stadium.
The reason why we named it after Chris Brownlee was, he was a hero. He was, a fighter. And, but I think that we felt that, in terms of creating an institution, it was important that people within the community, within the battle, be honored in that way.
As human beings, I think one of the things that differentiates us from other animals is that we take care of our own. And in this environment, in the AIDS environment, taking care of our own sometimes means providing people with a clean, warm place to live out the last days of their life, and a way to die without the distractions of homelessness or freaked out relatives or any of those things.
The significance of Chris Brownlee Hospice and later the other hospices, but particularly Chris Brownlee in the beginning, was that there was no other place for these people to go and be treated like human beings.
AHF later opened the Carl Bean House in underserved South Los Angeles and another near West Hollywood called Lynn House.
To give us our formal welcome address, Reverend Carl Bean.
It's a great day for all of us in that this is a day that will celebrate the lifting of oppression in this community. But most of all, don't just come today for the ceremony, but when the doors are open and patients are within, come, roll up your sleeves, visit, touch, hold, and heal, for that's the purpose of it all. God bless you and welcome again.
Scientists in the United States are claiming dramatic success for a new drug treatment for AIDS. 8 patients were given a course of 3 drugs in combination. And researchers found the virus was almost undetectable 2 months later.
In 1996, a new class of drug treatments was approved to treat people with HIV/AIDS. It was a combination of drugs, a cocktail, that was significantly more effective than all other previous drug treatments.
A year ago, Sean Strube was almost dead from AIDS. His body was covered with AIDS-related skin cancer. Now, taking a new combination of drugs, including a new class called protease inhibitors, he has gained 20 pounds, gone back to work, and the cancer is gone.
In 1995-96, we were operating 3 25-bed hospices: Chris Brownlee Hospice, Carl Bean House, and Lynn House. At the same time, in our healthcare centers and our research division, we were testing the cocktail, this new revolutionary breakthrough. And Dr. Charles Farthing, who was our chief of medicine at the time, was on the cutting edge of that.
I've really had about as close to a miraculous recovery, certainly more so than I ever imagined I would see.
When the drug became available and the miracle that it produced was clear, we made a decision to provide it to patients who were close to death to see if we could save them. So we started with providing the drugs to patients in our hospices, and we had no other choice but to pay for them because the government program hadn't been set up yet.
1996 was a watershed year in AIDS. It was the first time that treatment actually outpaced the virus.
The government didn't start paying for the drugs for people who couldn't afford them until July of that year. So we were supplying these drugs without getting reimbursement for them, not only in the house, but in the clinic as well. So we came really close to bankruptcy. What happened was virtually all of the patients got better within a month or 2. And whereas before that, hardly anybody left the houses. And most people, they came there and that's where they died. But all of a sudden, people were leaving and going back to their lives. And that was just miraculous. Once we had established the hospices and we had given people a place to live out their last days, we began to see that treatments for opportunistic infections were improving, and so the life expectancy was expanding. So we realized that what people really needed was medical treatment in an outpatient setting. So we began opening up clinics. So we said we can't operate clinics for the living with a name like the AIDS Hospice Foundation, so we changed it to the AIDS Healthcare Foundation.
The clinics came about not just as a response to overcrowding in the public health system for HIV, but really in a change of the agency's mission. I mean, we didn't want to be remembered only for being there in the last days of a person's life. We wanted to be there every step of the way.
To better serve people living with HIV/AIDS, AHF launched the Positive Healthcare Program.
Positive healthcare was an idea to take people that have HIV and AIDS and put them into a health plan that could really address caring for people with HIV and AIDS, and so they would not get lost inside of a regular health maintenance organization, an HMO. Michael Weinstein's vision was that he did not want to see people with HIV get put into systems that did not know how to take care of them.
At County, I kind of felt like I was just a number, and I feel that the clinic really centers towards women and minority, and I feel that that's something that a lot of people in other clinics in other areas don't acknowledge.
As we started getting more women, it was felt by AIDS Healthcare Foundation that we needed to look at the special needs of women.
It was important. It was groundbreaking. It was the only one in the nation. And it was so that people could feel safe, that they could know that people who were taking care of them knew what they were doing and cared enough about them to make sure that they could succeed in obtaining as much wellness as they possibly could with HIV disease.
Out of the Closet, which is the largest AIDS-related retail business in the country, it celebrated its 10th anniversary today at the flagship store in Atwater Village.
To further fund their mission, AHF put a social enterprise model into action, which is when a nonprofit creates a business to generate revenue for its own operations. For AHF, this came in the form of out-of-the-closet thrift stores and their own chain of pharmacies.
Well, the reason that we went into the social enterprise model is because we felt very hamstrung by government grants. We felt really had no independence in that model, and so we felt like we needed something that would allow us both to be independent and also self-sustaining. Part of the problem that nonprofits have is that they're really starved for resources. So if you go for a grant, the grant limits the amount of money you have for administration, and there's no money available to expand your program. It's a constant battle to put on the next event or to have the next fund drive, and it kind of diverts your attention away from your central mission.
Coming from the private sector, I was used to a business being run like a business. And when I came to AHF, I had in my mind that because it was a not-for-profit, it wouldn't be run like a business, it would be run more like a charity. But it's not. In fact, many of the business lines that AHF runs are actually more complex than the business lines that I worked with in my prior job. And that's important because we're not raising money to support shareholders or to make people rich. We're saving lives.
Our pharmacies are all full service and not for profit, so your business goes right back into the healthcare of our community. With us, it's people before profit.
So it's important to make sure that we are good caretakers of that money and we're good caretakers of the people who entrust their lives to us. So it is a moral imperative for us to be good stewards of the money that we raise.
By 1999, AHF had 6 outpatient clinics in Los Angeles County, 15 out-of-the-closet thrift stores, and a growing national reputation as an effective and forceful advocate for people living with HIV and AIDS.
Once we came out of this financial crisis that we had when we were starting to treat patients in '96, we said to ourselves, you know, we need to bring as many people into the lifeboat of care as we possibly can. And that's not based on one city. So we began to expand. And the big breakthrough for us was when we got a contract with the state of Florida to provide care in all 67 counties.
Magic in the Magic City. Magic Johnson, that is. The legendary athlete is launching a free HIV clinic in North Miami Beach as the local basketball star cheers him on. He's partnered with the AIDS for Healthcare Foundation to open 4 other Magic Johnson clinics throughout the country.
And then, you go to places like Jackson, Mississippi, where the stigma is so intense and the need is so great. But that's the ethos of AHF, is to go where the need is the greatest.
A cross-country HIV testing tour kicked off in the West Adams district today. The nonprofit AIDS Healthcare Foundation launched a 3-week, 14-city campaign to increase the number of Americans tested. Mobile HIV testing vans will be driven to cities across the country where they will set up shop in parking lots at malls, nightclubs, and other popular places. The tour will end in Washington, D.C. in time for National HIV Testing Day on June 27th.
When we started in LA, we went to South LA and we went to Echo Park. We went to all these places. We didn't expect people to come to us, we went to them. So now we are in many of the southern states where the need is the greatest. We're in most of the epicenter cities in this country.
In 2000, planning to attend the 13th International AIDS Conference, Michael Weinstein traveled to Durban, South Africa, where people were dying from AIDS by the thousands.
When I attended the International AIDS Conference, they had a opening ceremony in a big cricket stadium. And the ceremony was an extravaganza. It was more like Cirque du Soleil than the opening ceremony of an AIDS conference. And there was a lot of buzz about what the president was going to say, President of South Africa, and Becky. So we were in the stadium, and he came out to speak. And he said that AIDS was caused by poverty.
As I listened and heard the whole story told about our own country, it seemed to me that we could not blame everything on a single virus. The world's biggest killer and the greatest cause of ill health and suffering across the globe, it is extreme poverty.
And he was sending a clear message that HIV didn't cause AIDS. He was doubling down on that. And so a bunch of us got up and walked out. I went back to my room, and the porter said, there are people looking for you. I said, oh, okay. And I went to my room, and I noticed that somebody had slipped a note under my door. And they said, we're local activists. We're sitting downstairs in the restaurant. We're going to wait for you. So I went to see them, and we talked. And I said, well, going to a conference like this and having all these academic papers presented is fine, but I'd like to really see what's happening in the community. So I said, can you take me out and show me? So the next day we rented a van and we went out and we visited a lot of different sites, and it was just heart-wrenching. In all that I had seen, people dying of AIDS, when I went to the hospital wards there and saw young women so filled with hopelessness, it was just a terrible thing.
Before we left, I remember Michael saying, I'm not so sure that, even if we're confronted with, how horrible the situation is, whether there's much we can do, but we're going to go anyway, and we'll see. And at the time, the president of South Africa, Thabo Mbeki, was, the world's biggest AIDS denialist. And, his administration was putting out information that the new drugs in the developed world were poison. And so a group of us went to South Africa, and I knew that it was going to change the organization forever.
Teaming up with local AIDS activists who were also willing to defy the South African government, AHF opened its first clinic, Itembalabantu, in Umlazi, South Africa.
When it was clear that the benefits of treatment would work in Africa, we started to help people, and people got better, and their neighbors saw that they were getting better, and so that increased demand.
Shortly after the success of the Itembalabantu clinic near Durban, AHF went on to open another clinic in Uganda.
By the time AHF came to Uganda in 2002, the situation was already very dire. People had been dying left, right, and center. And AHF was the first organization to offer ARVs in public health settings, working with government to offer this much-needed medication.
By the time we got to about 3,000 patients in Uganda, which was some years later, I just remember thinking, the enormity of the work we were doing and how important it was. And so we started pushing our own government to do more.
AIDS can be prevented. Antiretroviral drugs can extend life for many years.
President Bush was in the White House, and in the State of the Union address at one point, he made it a centerpiece aim of his, to develop what came to be known as PEPFAR.
And to meet a severe and urgent crisis abroad, tonight I propose the emergency plan for AIDS relief.
A few years later, thousands of Ugandans marched with AHF on World AIDS Day.
Today in Uganda, there are still more people dying of AIDS than living with ARVs. So we will turn that tide, I hope, very soon. But every day counts in that battle. Because our goal is not only to save lives, but our goal is to end the scourge of AIDS in Uganda, in Africa, and the world.
The whole global project of AHF, this whole incredible adventure started in Durban. And I've been back to Durban many times since then. But this was only the second time that the conference was on the African continent, and it was coming back to the same place where it had started in 2000. And we had made the decision that we were going to have a massive presence at the conference, including a march and a concert.
The march in Durban in 2016 was the culmination of many years of AHF organizing marches. We needed that march to be big.
Honestly, I was shocked by the turnout, and I couldn't believe how many people were there. We had Queen Latifah, we had Common, and we just filled up the street with a sea of green T-shirts. It was really a wondrous thing to behold.
To see the mayor of Durban there, the community activists and gatekeepers, but it's really the clients that inspire me. Again, you can't but help feel really good about the work that AHF has been engaged in for 30 years and the significant impact that we've had on a global level in terms of saving lives, impacting public policy, and trying to stem the tide of HIV disease on a global level. So I feel really proud to have been a part of that process for the last 29 years.
In my heart, I was just amazed. It was such a beautiful thing that so many people came out 15 years later after we started there to march, to raise the flag, on HIV/AIDS, that it's still a crisis. It was one of the best moments of my life.
We made history in South Africa, and that day was the celebration of that.
There's still so much to do for all of us at AHF and around the world that work in this field. For us specifically, one of the goals is to get 1 million people under AHF's care, and we're getting close to that. We're getting close to 800,000, so that's coming. We're going to be in 50 countries before you know it, and we really have to keep the advocacy up for test and treat. One of our strongest campaigns is 20 by 20, and that's to make sure that 20 million people are on treatment by 2020. And we hope that it's many more than 20 million. It should be much more than 20 million, but we're not there yet.
I think our future is one where we are going to continue doing what we've always done as a treater and as an advocate. We're going to continue to build programs. We're going to continue to add sites in different parts of the world where the need exists. We're going to continue to push donor countries to put adequate resources on the table to deliver this care.
In addition to that, we have to fix the public health system. You know, if we ran air traffic control the way we run global public health, planes would be colliding in the sky every single day. It's chaotic. If we want to have a really integrated system of care on an international basis, not only for treating HIV, but for conquering TB and malaria and other infectious agents that are going to come along, including sexually transmitted diseases, we have to have an integrated system, and that needs to be based upon a global treaty, global convention on public health. And so that would be my biggest ultimate goal.
It's important for AHF to continue fighting for what's right, because there is no sense of urgency that we see, around the world. It's a critical time. We're in a fork in the road. There is a goal and a plan to stop AIDS by 2030, and we think that that's actually possible, but with a lot of shakeup and a lot of fighting to restore a sense of urgency and maintain it. So we feel we have a very strong role, and it's mainly to remind people that AIDS is not over and that we're still in a crisis.
I mean, what I would say to the people who work for AHF or part of the AHF community is that I'm incredibly proud of you. I think that there's very few places in the world where you can be a part of history, where you can genuinely say that you've saved lives, that you've changed lives. And I hope that people who work for AHF and who are part of the AHF community, that they take as much pride and that they understand what an important contributor they are to the big success that we've had.